is proper diagnosis and effective, non-invasive outpatient treatment. Decades of leadership, first in New York with brain radiosurgery, first in America with body radiosurgery for cancers of the brain, body, and prostate, all custom-tailored for you. Call 212-CHOICES, 212-CHOICES for a prompt appointment and free booklet DVD. Super convenient, 38th and Broadway, with most insurances, Medicare, Medicaid accepted. You're next at Radiosurgery New York. Just call 212-CHOICES, 212-CHOICES.
You know, cancer, it's not prejudice. It strikes everyone. We've seen the racists with the big C. We've seen humanitarians struck down with the big C. But there are remedies, even if you've already had different measures of treatment, like prior chemo, surgery, or radiation that didn't work. Now, I'm telling you, there's a guy out there who is clearly the best at this. First tryout or second tryout, that's Dr. Gil Lederman. My personal experience in 1991 is he came up with a remedy for my dad. Others had passed on it or just couldn't figure it out. He was able to save my dad's life, and my family will always be grateful to him. But look, if you have newly diagnosed and recurrent cancers anywhere in the body, Gil Lederman's the guy to go to. He's a brain and prostate cancer as well as body cancer expert, also treating breast, lung, pancreas, liver, kidney cancers, and more. So, to hit the cancer, you call 212-CHOICES and set up an appointment with Dr. Gil Lederman, 212-CHOICES. Or do it for someone that you know won't do it for themselves. He'll send you an informative booklet DVD in advance, and then you cop a squat with him at his offices at 38th and Broadway. Dr. Gil Lederman takes most insurances, Medicare, and Medicaid. Just call Dr. Gil Lederman for your cancer treatment choices at 212-CHOICES, 212-CHOICES, 212-CHOICES.
Welcome back to the Radiosurgery Hour. This is Rob Redstone here with Dr. Gil Lederman at the WABC studios in the heart of New York City. We're just a few steps from the Radiosurgery New York Cancer Treatment Center on Broadway and 38th Street. Dr. Lederman, the leading cancer expert, treats prostate cancer non-invasively. He was the first in New York with fractionated brain radiosurgery, and he's the first in America and in the Western Hemisphere with body radiosurgery. Hey, Dr. Lederman, we're back.
We're back, and this is Dr. Lederman, the Radiosurgery Hour. We're here talking about cancer. We work at Radiosurgery New York in Manhattan. We're a cancer treatment center, and we're devoted to treating cancers of the brain, cancers of the body, the breast, the prostate. That's what we do. It's a private cancer center that we work for you, not the drug companies, not the surgeons. So if you want choices, and if you want to be treated like you are the president of the United States of your body, give us a call at 212-CHOICES. There's a news article that just came out, New York Times this week, that the FDA on Thursday approved a new class of cancer drugs. That Merck is selling this drug called Keytruda. The idea is it's supposed to unlock the immune system, so a lot of people like the idea it's going to unlock the immune system. This group of drugs are called PD-1, or Programmed Death Receptor 1 drugs. This new drug is not cheap. It's going to be $150,000 a year. So what does $150,000 a year buy you for melanoma? Well, there was a study of 173 patients who received the drug. There was no control group. So usually in medicine, we like two groups, one that gets the new drug and one that doesn't get the new drug, and see who lives longer. So, no, we don't have that, and that's a failing in this study. There should be two groups, the treatment group and a control group, because often we see the patients live the same amount of time, whether they get the chemo or not. So, there's a phase 1 trial, which means it had never been used in human beings before, 173 people with melanoma, and it worked in 24% of patients. Okay, which means in 76% it did not work. So I know people are going to clamor, I want that drug, I want that drug. 76% of the time it doesn't work. And it costs $150,000 a year. And even in those that it worked, they said the effect, this is an article by Andrew Pollack in the New York Times, in people worked, it worked from 1.4 to 8.5 months. Wow. It's hard to get excited about that. We treat melanoma. Our success rate is 90% where we aim to be. We're treating, for example, a man right now. He had had chemo and immunotherapy at a big cancer hospital for 6 years. They told him for 6 years his cancer was stable, the CAT scan was okay. And then he comes to us, and we find out that it grew from 3 centimeters to 4 centimeters to 6 centimeters to 8 centimeters to 10 centimeters, and now it's 13 centimeters. The bulk of it is 1 liter. So if you think about a liter bottle of milk or something, he's got a liter of melanoma in his chest. He was on immunotherapy for 6 years, kept on growing, and he was told it was stable. He was so irate. He came to us. We are different. We give people the documents. You can read your paperwork. We give you the images. You can look at your images. You can see what you have. You can compare it yourself. You'll read the report. We are different than a lot of places, so we encourage you to participate. You are the President of the United States in our eyes, and we serve you. So, yeah, it's a big drug, $150,000, works in only 24% of patients, and in those that worked, it worked from 1.4 to 8 months. So is it a breakthrough? Maybe, maybe not. They should get a control group to see who lives longer. Do you live longer if you spend $150,000? Well, first of all, you know that in 76% of the patients it didn't work. So it's highly unlikely that a group that got treated would live longer than a group that didn't get treated. But that tells you about melanoma and what's going on in the industry. And if you're skeptical, I think you have a right to be skeptical. $150,000 when it only works in 24% is not so fantastic. And here's another patient, almost similar in a different kind of way, though. It's a man about 65 with metastatic lung cancer. He came to me last winter with right lung cancer and a mass growing up his right neck. So he had a painful mass in the right neck, and he was getting chemotherapy at a big hospital in Manhattan, and he heard about us, and he investigated radiosurgery, and he liked the idea that we hit the cancer, we don't hurt healthy tissues. We treated him 5 treatments to the neck, to the lung, and then now, so it's about 9 months later, he got a new PET scan, and doctors told him elsewhere that it's, let's see, we have a call. Let me see who's calling us. You're on the radio. Good morning. It's Dr. Lederman.
Good morning. I'm listening, and you're supposed to send a DVD or something?
We're happy to send a DVD. Call us during the work week, Monday through Friday, at the same number, 212 Choices, and we'll put the DVD and the booklet in the mail to you, okay?
Thank you. Bye-bye.
God bless you, and thank you. Bye now.
Goodbye.
So if you want that booklet, just call us during the work week, 212 Choices. We will put it in the mail to you. So this man, he was told elsewhere, remember he had lung cancer, he's about 65, he had chemo at a big hospital, but he wanted radiosurgery because he liked our data. So he got radiosurgery with us, chemo there, and then he had a new PET scan, and over there, he was told, it's all messed up, your PET scan's all messed up. So we got the report. They didn't give him the report. We gave him the report. We got the report. I called the radiologist. We compared the new and old. What's messed up? Well, what's messed up is the cancer we treated is gone, and the chemo, so the chemo should have affected the whole body, right? The chemo gets injected in a vein, and it goes from head to toe. It's not directed. It's like putting you in the bathtub. Well, in the lung, on the right side, in a new area, there's a 4-centimeter mass, a new mass, which is PET scan positive, which wasn't there before. The cancer we treated in the neck and the chest, where we treated it, is gone. Where they treated it, it's growing. So, yeah, of course they wanted to say it's messed up. It sounds like a little bit like our President Obama, that the world is messed up. Yeah, guess why it's messed up? Well, same with this patient. Where we treated, the cancer's gone. Where they treated, it's growing. He wants, guess what he wants now for this new 4-centimeter mass in the right lung? Take one guess. Yeah, he wants radiosurgery, 5 treatments. He's tired of the chemo. It didn't work. He had side effects. He likes treatment that's effective. And we have data. We've treated about 20,000 men and women and children like him. We treat young people, by the way. And the beautiful thing about radiosurgery for young people is there's less harm to the healthy tissue. But that's true for everybody. We don't believe that we should only protect the body of young people. We should protect the body of everybody, you and everybody. This man said to me, and it was a compliment. It was really nice. He said, "Doc, you're different than the other doctors." We have another call. Let's see who's calling. 1 minute. You're on the radio. It's Dr. Lederman.
Good morning. I just called about a minute ago, and you told me to call during the week during business hours, and the last thing you said to me was, "God bless you, bye-bye," and I'm just calling back to say God bless you.
Thank you very much. I appreciate that.
So long.
Bye now. Yeah, doctors need that. There's a new article which we're going to talk about a little bit. That a lot of doctors suffer a lot, and sometimes patients don't realize doctors are human beings too. So this man, lung cancer, he had chemo. The doctor told him it's messed up. Yeah, it's messed up because the chemo didn't work. Radiosurgery worked. Radiosurgery made the cancer go away. He has no cancer where the radiosurgery was. He has a new cancer where the chemo treated him. And so he's going to have 5 more treatments of radiosurgery to this 4-centimeter mass. And we had another man who walked in, and he's a very interesting man, and I'll tell you why in a minute. He's 84 years old. He's single. He has no children. His PSA was 24. So PSA is prostatic-specific antigen. It's a cancer marker, and we talk a lot about it. For some reason, a lot of cancer patients aren't told there's often markers, and those markers will tell you if the treatment's working or not. And I think a lot of doctors don't want to tell you about the markers because if you knew the marker was going up, it would mean the treatment's not working, and it means you should stop it. So he had a PSA of 24. He had a biopsy which showed a Gleason 9. So I often talk about the Gleason score. It ranges from 2 to 10. It's not very commonly 9. He has 4 areas of 9. He had a CAT scan and a bone scan elsewhere that was negative. He came to us, just for the booklet yesterday, and spoke to one of my staff members. One of my staff members gets radiosurgery. She said, "Come and see Dr. Lederman. You might like him." So he came in, we spoke, and took the history. And I said, "Let me examine you." And I examined him. Now, I've seen multiple doctors at big hospitals around. And he decided to come for treatment for his Gleason 9, PSA 24 prostate cancer with us. Guess why? Because of all the doctors, we're the only one who examined his prostate. Can you believe it? He was seen by all these doctors, and no one took the time to examine his prostate, which was rock hard. It's hard as his desk, like a rock. Gleason 9, PSA 24. He's coming with us. And if you look at the data for Gleason 9 cancer, and again, it's in our booklet, and we'll mail it out to you if you call us during the work week. Page, and there's multiple graphs, but if you look at our data, us versus the groups in Boston and Philadelphia, our results are more than double the chance, about 125% increased survival rate, cancer-free for Gleason 8, 9, 10. And in half the time, at less the cost. So, obviously, someone with prostate cancer, and we believe that men with prostate cancer want to have the highest chance of being cancer-free. We believe they want to avoid radical surgery, even robotic surgery, which is associated with high complication rates, despite what they say. We believe men want to keep sexual life, and men want to keep their urinary life, and that's our aim, and that's what we actually do for most men. So the vast majority chance for Gleason 8, 9, 10 with us, he'll be cancer-free. It's non-invasive treatment compared to radical prostatectomy. It's half the time compared to the 9-week of treatment. And we will follow him and report back to you. We have another caller on the line. 1 minute here. Radiosurgery New York, you're on the radio.
Yes, is this Dr. Lederman?
Yes, and you're on the radio. You're speaking to about 20,000 people.
Oh, I am. Okay. I have the radio on. Maybe I should shut it off.
What's your question today?
I was recently diagnosed with stomach cancer.
Sorry to hear that.
And it might be metastatic cancer because I had lung cancer treatment. It was just a small lesion, a nodule, and that was in January. I'm also a breast cancer survivor of 24 years. And I was wondering if you treat stomach cancer with this radiosurgery.
Yes, we do. Yes, we do. We'd want to see you and sit down with you and go over all the documents, but our success rate is very high. If it's lung cancer metastatic, our success rate's 90%. Actually, it's the same for breast, even in the stomach or wherever it might be.